sir, I'm Althea, your student nurse, and you are?
Bel Paglinawan.
How would you like me to call you, sir?
Bel.
Okay, Sir Bell. So for today, we are going to assess your nose and sinuses. I want you to stay calm for me because this will serve as information about the current status of your nose and sinuses. Would that be okay with you?
Yes.
Okay. So I'm here now at the patient's room. I wash my hands, I don the non-sterile glove, and provide the privacy of the patient. Okay, sir, before we start, I just want to ask you some quick questions about your history. Would that be okay with you?
Yes.
Okay, great. Do you have any allergies?
None.
Difficulty breathing in the nose?
None.
Any sinus infections?
None.
Injuries to your nose or face?
None.
Nosebleeds?
None.
Any medication taken?
None.
Okay, last year, any changes in the sense of smell?
None.
Okay, great. Sir, I will now inspect your nose and sinuses. Would that be okay with you?
Yes.
First is inspect the external nose for any deviations in shape, size, or color and flaring or discharge from the nares. Thank you, sir. Then, lightly palpate the external nose to determine any areas of tenderness, masses, and displacement of bone and cartilage. Okay, no tenderness. Thank you for that. Then, determine the patency of both nasal cavities. Ask the patient to close his mouth and put pressure on one nares and breathe to the opposite nares and repeat from the other side. Okay, sir. Close your mouth. Press this one and try to breathe. Okay. The other one. Okay, thank you for that, sir. Next is inspect the nasal cavities using a flashlight or nasal speculum and observe the presence of redness, swelling, growths, and discharge. Also, inspect the nasal septums between the nasal chambers. Okay, thank you for that, sir. And lastly, palpate the maxillary and frontal sinuses for tenderness. Do you feel any pain?
No.
How about this one?
No.
Okay, thank you, sir. Okay, sir, so at this point, we are going to assess your mouth and oropharynx. Would that be okay with you?
Yes.
Okay, so before that, I just want to ask you some quick questions about your history. Is it okay?
Yes. Okay.
When was your last visit to the dentist?
I don't remember the last time I visit in dentist. I think it's long time ago.
I see. Do you have any lesions present in your mouth?
No. None.
Okay, great. So, sir, I will now inspect your mouth and oropharynx. Would that be okay?
Yes.
So, first is inspect the outer lips for symmetry of contour, color, and texture. And also instruct the patient to purse her or his lips like whistling. Okay, sir, would you purse your lips for me? Thank you for that. Next is inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and presence of lesions. Okay, thank you for that, sir. For teeth and gums, inspect the teeth and gums while examining the inner lips and buccal mucosa. Say, sir. Okay, thank you for that. Next is inspect the dentures. If your patient wear dentures, instruct the patient to remove it, then inspect his condition. So in my case, my patient don't wear any dentures. Okay, next is the tongue or floor of the mouth. First is inspect the surface of the tongue for position, color, and texture. Okay, sir, can you stick out your tongue for me? Okay, thank you for that. Next is inspect the tongue movement. Instruct the patient to place the tip of her or his tongue at the roof of the mouth. Okay, sir, can you place the tip of your tongue at the roof of your mouth? Okay. Thank you, sir. Next is palpate the tongue and the floor of the mouth for any nodules, lumps, or excoriated gas. Can you stick out your tongue, sir? Thank you for that. Also, for salivary glands, inspect salivary duct opening for any swelling or redness. Okay, no redness. It's all fine. Thank you for that, sir. Next is palates and uvula. Inspect the hard and soft palates for color, shape, texture, and the presence of bony prominence. Okay, sir, this time, open your mouth wide. Okay, thank you for that, sir. Then for oropharynx and tonsils, inspect the oropharynx for color and texture. Inspect one side at a time to avoid eliciting the gag reflex. So to expose one side of the oropharynx, press a tongue depressor against the tongue on the same side about halfway back while the client tilts his head back and opens the mouth wide. Okay, sir. And also use a pen light if needed. So in this case, I will use pen light and a cotton swab. Okay, thank you for that, sir. And lastly, inspect the tonsils for color, discharge, and size. Okay, sir, thank you for that. We're done.